If you are currently studying for the DANB RHS exam, this is the video you need. Hey DA besties, it's your girl Leela. Who else? Welcome back to
the DA Study Spot, yeah.
Today's video pulls together the most testable RHS content from the 15th edition MDA textbook. We're covering digital imaging systems, radiation protection, legal compliance, and infection control in radiography. This is digital-only content straight from the current RHS DANB outline. So grab your notebook and let's get started. But before we do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! Let's start with how a digital image is actually captured. And there are two systems.
The first is direct digital imaging. It uses a solid-state sensor like a charge-coupled device or CCD to capture the image directly and transfer it to a computer using specific software. When exposed to X-rays, the sensor immediately converts the X-ray energy into an electronic signal. The second system is indirect digital imaging. This uses a phosphor storage plate or PSP. These plates are similar in size and flexibility to traditional film. After exposure, the PSP stores the image as a latent image, which is then scanned by a laser scanner to convert into a digital image.
Now, no matter which system you use, obtaining a digital image happens in 4 steps: image generation, processing, archiving, and viewing.
During image processing, the dental software allows adjustments to contrast, which is a density observed, differences in black to white, brightness, the balance of light and dark, image size, zoom, the physical size of the image, sharpness, how well defined the edges of a structure are, pseudo color, which alters a black and white image into a colored one, and inversion, which flips the image from white on black to black on white.
These adjustments help achieve the best possible diagnostic image without retaking exposure, which matters because retakes mean unnecessary radiation for patients. This is one of the most important concepts on your entire RHS exam, ALARA. It stands for as low as reasonably achievable. ALARA is a principle implemented over 50 years ago and designed to minimize radiation dose to the patient and their surroundings to a level that's low as reasonably achievable. Today, this principle covers all types of imaging, exposure time, and diagnostic justification.
The ADA published specific recommendations in 2024 for minimizing radiation exposure, such as prescribe radiographs based on clinical need. Don't use a set schedule for every patient. Use digital receptors instead of conventional film. Restrict the X-ray beam size using rectangular collimation. Properly position patients so the best image can be captured the first time. Only incorporate CBCT when lower exposure options won't provide necessary information, and adhere to all federal, state, and local radiation safety regulations. Now, the recommended sequence for determining if radiographs are necessary would be to first complete a thorough clinical exam, then consider the patient's medical and dental history, review prior radiographs, complete a caries risk assessment, and consider the patient's overall health. For pediatric patients specifically, the ADA has joined the Image Gently Coalition, so we have to make sure we're using the fastest image receptor possible, collimating the beam to the area of interest using child size exposure time, using CBCT only when necessary, and always using thyroid collars.
Okay, let's talk a little bit about the legal side because this absolutely shows up on your exam.
Starting with credentialing, the Consumer Patient Radiation Health and Safety Act is a federal law requiring all persons who take dental radiographs to be adequately trained and certified. Individual states then establish their own certification requirements. Then we have informed consent. Patients must give informed consent before dental images are taken. They must be told the risks and benefits, who will be exposed in the radiographs, the number and type being taken, the consequences of not having them, and any alternative diagnostic aids. Next is patient refusal, and you're going to get a lot of these. If a patient refuses radiographs, this must be documented in the patient's record. No document can release a dentist from liability for treating a patient without radiographs. A patient cannot legally consent to negligent care. Then we have patient records. Documentation must include informed consent, the number and type of radiographs, the rationale for requiring them, and diagnostic interpretation. Next, we have ownership. Legally, dental radiographs are the property of the dentist, even though they are part of the patient's record. Patients have the right to request copies through a written, signed request, but the original radiographs must never be given away. Lastly, there's liability, which under state laws, the supervising dentist is legally responsible for actions of dental auxiliary personnel. This is called the respondent superior doctrine, but dental assistants can still be held legally liable for their own actions.
Quality assurance, or QA, is a program of regular testing. It is to detect equipment malfunctions and ensure compliance with state and federal regulations.
A stepwedge is a device constructed of layered aluminum steps. When placed on an image receptor and exposed, the different steps absorb varying amounts of radiation, creating a visible gradient of densities. This is used to test the consistency of X ray machines and film processing. A reference radiograph is used as a daily baseline to compare and assess the quality and characteristics of a dental radiograph. The American Academy of Dental Radiology recommends annual tests for dental x rays machines to identify variations in radiation output, inadequate collimation, tube head drifting, error in timing, and inaccurate kilovoltage and milliamperage readings.
This is the last section, but it is the biggest because it ties directly into your infection control knowledge, but applied specifically to radiography.
There's always a risk of cross contamination with both film based and digital techniques. The CDC has recognized dental radiology as a potential source of cross contamination. Surfaces likely to be contaminated during X ray procedures would be the X ray tube head and PID, the X ray control panel, the exposure button, the lead apron, dental chair controls, operatory counter surfaces, and the computer, monitor, and mouse. The exposure control should be covered with a clean barrier and changed after every patient. The tube head, PID, control panel, and exposure button must be covered or carefully disinfected. The dental chair's back, arms, headrest, and adjustment controls must be covered or disinfected, and the lead apron should be considered contaminated and wiped with a disinfectant after each use. Keep in mind that digital sensors are considered semi-critical items, and the CDC recommends covering the sensor and any cords with an FDA-cleared plastic sensor sleeve. Since sensors cannot be heat sterilized, this barrier protection is essential. After the procedure, the sensor should be cleaned and disinfected with an EPA-registered intermediate-level disinfectant before use on another patient.
All right, besties, that is your comprehensive RHS breakdown. Digital imaging systems, ALARA, legal compliance, quality assurance, and infection control in radiography. This is all exam relevant, so make sure you save this video so you can come back and watch it again before exam day. If you have an exam day coming up, drop it in the comments so we can all root for you. And as always, if you want more practice questions to lock in this info, check out my Ultimate DANB Certification Study Guide linked in my bio. 375 plus practice questions with answers and rationales that covers all 3 DANB components. Link is in the description and I will pin it in the comments as well so it's easier for you. If you find this video helpful, like, save, subscribe, and share with a DA bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.